Good afternoon. Thank you everyone for joining us here in Washington, D.C. office of Mathematica Policy Research, and thanks also to everyone attending via webinar. I'm pleased to welcome you to today's forum on improving public programs using advanced data analytics. My name is Ann Person, and I'm the director of the Center for Improving Research Evidence, or CIRE. And before we begin, I'd like to say a few words about the center. CIRE is uniquely positioned to bridge the gap between policy research and practice by offering a broad array of expertise in designing and using scientific research and evaluation approaches in diverse settings. Specifically, we seek to build capacity to understand and use evidence, to plan rigorous and relevant evaluations, and to improve research methods and standards. For our discussion today, we'll explore advanced analytics and how they can be used to improve public programs. The forum will be broken into 3 sessions. And by the way, the agenda for the sessions and bios for all the speakers are included in your folders or on the Mathematica website for those on the webinar audience. For our first session, Mathematica's Director of Data Analytics, Miles Maxfield, will set the stage with important context about data analytics. After that, CMS's Chief Data Officer, Niall Brennan, will share his perspective on why quality in analytics is so important for improving public programs. After Miles and Niall speak, I'll pass moderator duties over to Stuart Buck from the Laura and John Arnold Foundation, and he'll lead us through a panel on analytics in action. After that, J.B. Wogan, a journalist with Governing Magazine, will lead us through a discussion on the data analytics frontier. These 2 panel discussions will last about 30 minutes each, including 10 minutes at the end, where we'll have the opportunity for both in-person and webinar audiences to pose questions to our panelists. And then finally, for those of you here in the DC audience, I encourage you to join us and the panelists immediately after the forum for a networking reception here in the Mathematica lobby. Before we get started with presentations, I have a few housekeeping reminders. Our session today includes the in-person audience and the webinar audience, so I'd ask that those of you here in the DC Center please turn off all of your electronic devices. Please note that we're also video recording today's session, so we may capture images of some of you in the in-person audience. That recording will be posted on the CIRE website next week. As I said, we welcome questions from the in-house audience and from our webinar audience. For those of you participating online, please submit your questions electronically using the Q&A panel on your screen at any time during the presentations, and then we'll alternate your questions with those from the in-person audience. Now, I'm pleased to turn it over to our first presenter, Miles Maxfield.
So welcome to our forum. This is what we're going to do today is present and discuss the proposition that data analytics in general and advanced analytics in particular have substantial untapped potential for supporting officials running public programs in making their programs more effective and designed in a more effective way. In the next few minutes, I'd like to define some terms so we can use a common vocabulary for the rest of our session together. Second, I'm going to offer several specific applications of advanced analytics to federal health programs, which corresponds with my background, which I hope will illustrate why the topic is so important for all of us. In the past few years, there have been a lot of press and a lot of popular books about analytics, data analytics. So much attention, and it's become so faddish that, as far as I know, this is an area that has more vaguely defined buzzwords than any other discipline in social science that I'm aware of. This has led, and we're trying to illustrate the confusing part of this on the slide here, why this is confusing. It really does leave me confused, and occasionally struggling to figure out how any of this stuff can be of use in public policy. So I want to go back to basics for a minute. This is in the spirit of defining terms. Google Maps by itself is not what I consider data analytics. However, Google Maps with a traffic layer very much is data analytics. There's a continuous flow of data into Google from cell phones in the pockets of people on the freeway. Google applies an algorithm to figure out if it's red, yellow, or green. It pushes that out to me on my cell phone. And I improve the efficiency of my operations based on that information, and I get off the freeway. An example that's closer to home is work that we're doing now for the Center for Medicare and Medicaid Services, or CMS, where we're measuring the cost and quality of health care delivered by accountable care organizations, or ACOs, in one of CMS's programs. And I'll be showing you what that dashboard looks like. CMS is using that information, pushing that out to the ACOs themselves so they can improve their performance, and CMS itself is using it to fine-tune the program itself. So back to terminology. In the popular press, big data is often used synonymously with data analytics, and I would like to just assert that they're not synonyms, even though everybody uses them as if they were. It is very, very possible to do data analytics using small and medium-sized databases. So, before we define advanced analytics, let me define basic analytics. Here I've listed several characteristics of basic analytics, the heart of which, in my view, is designing performance indicators that actually support the policymaker's decision. This is surprisingly difficult to do. It's very common to find data analytic performance measures that are pretty interesting, but don't actually help you make a decision about what to do next. The point I'm making here is that by using the term basic, I do not mean for a second that these are simple or easy to do. They're designing performance measures that actually support a particular decision are quite nuanced and sophisticated. This is just an illustration of the dashboard I referred to a minute ago for accountable care, health care organizations. And I just wanted to show you what it looked like. So we're going to move on to advanced analytics. Here we list some broad categories of what the advanced analytics can do in the public sector. Broad categories. It can forecast what the future performance will be as opposed to measuring what their performance was a year ago. It can predict an outcome variable that's not directly observed in a database. For example, fraud and abuse is not measured directly in any database, but can be inferred from a combination of indirect indicators. Advanced analytics can suggest reasons for why the program's performance is what it is, reasons that had not occurred to you. And I'm referring to this as hypothesis generation, as opposed to what we normally do in social science of hypothesis testing. And finally, you can try out your ideas for operational innovations quickly enough to provide fast feedback, fast enough so that you can think of it as continuous quality improvement of your program. Here's a list of advanced analytic methods that we think have untapped potential. It's a long list. I'm not going to go through it. What's important here, however, in the end, is not what the tools are, and these are the tools. It's what the applications are. It's what you can do with these tools that's important. So my final two slides show a list of potential applications to federal health programs that have occurred to me. I'll leave this slide on for just a second and then move on to the second half of this list. You can all read this in the slides that you have. Again, it's a long list, and I'm not going to take the time to go through it, but I will call out just one of these at the end, the last one, which is it would be really interesting, I think, to do rapid cycle experimentation with alternative approaches to hospital discharge planning in an effort to reduce hospital readmissions. Even though, since these are my ideas, I think many of these ideas are pretty cool. That's not really the point. The point is that with a little familiarity with the techniques of advanced analytics, that each of you could come up with a list that you think are pretty cool on how to make your programs run more effectively for your beneficiaries. At this point, I will stop, and I'm delighted to introduce my colleague Niall Brennan, who is simultaneously the Director of the Office of Enterprise Data and Analytics at CMS and the Chief Data Officer.
Thank you, Miles. Good afternoon, everybody. It's a pleasure to be here. I'm delighted to talk to you about the importance of quality and data analytics for public programs. When they first asked me, I was a little bit nonplussed. I was like, well, I'm certainly not going to get up here and argue that a lack of quality is important in analytics around public programs. So, quality, it's not just important, it's all important. It's absolutely crucial to what we do. And actually, as we change in government and the public sector to a greater reliance on analytics and data-driven decision-making, we're still, at the, I think, on the early edge of this frontier. So actually, I think lack of quality will, potentially doom many of these efforts. I think another thing that's very important for me is that you can have, and Miles touched on this a little bit earlier, you can have analytics that are of the highest statistical and methodological quality, but are so deathly boring that any actual policy decision maker will tune it out within the first 30 seconds. So one of my overarching goals in a lot of the work that we do is that, yes, it has to be high quality, but it also has to be very tangible and relevant to the decisions that people are making. So why is it important? Well, we affect lots of lives. We're well over 120 million at this stage. That's just Medicare and Medicaid, not counting the almost 12 million people who signed up through the federal and state exchanges during the most recent open enrollment period. We generate lots and lots of data, but again, our decisions affect over 100 million lives, and as much as 20% of the U.S. economy, depending on how you counted. So, if we get a quality resource use report wrong on a physician, that's a bad thing, reputationally and financially for a physician. No pressure, Jeff. If we, during open enrollment, my office is responsible for monitoring a lot of metrics, but particularly plan selection on a daily and sometimes on an hourly basis. And those results go to, pretty important people. So, giving, the President of the United States an incorrect plan selection number, that's a pretty bad thing and not very highly recommended for career longevity. And then just another example, we've been very active in the open data space in recent years at CMS, and that's also a type of analytics. I think a lot of people think that there's just a kind of a magical staples-like easy button that we press and prescription drug data gushes forth, or Part B utilization data gushes forth, but there's a ton of work that goes into those, and it's very important because, again, if we ascribe the wrong utilization or prescribing patterns to a physician in the name of an open data or transparency initiative, that's also a bad thing. So there are many, many, many more examples that I could give. And so in setting up the office and creating the chief data officer position, I think CMS formalized and institutionalized what had been a gradual journey over the past 5 to 10 years, where it became very clear that we really weren't going to be able to fulfill our mission as an agency to improve care, improve quality, lower cost, expand coverage without becoming significantly more reliant on analytics, high-quality analytics, to drive our decisions, to give feedback loops to providers, to empower beneficiaries, et cetera, et cetera, et cetera. So it's a very exciting time at CMS. So I wanted to just highlight a couple of the ways in which we're approaching data and analytics right now. I'm not sure if all of them formally fit into Miles's definition of advanced analytics, but we're the government, so we're a little bit behind. We're kind of doing crawl, walk, run, but we are doing a lot of, I think, very cool stuff that hits at many of the things that Miles mentioned. The ability to graphically represent stuff a picture can tell 1,000 words. We're also doing a lot of things that I unfortunately at the moment sort of can't tell you about. I'll say, oh yeah, the really complex stuff I can't tell you about because everything is top secret and has to be cleared. But we're examining things like outreach efforts and the impact of emails and different things, especially with our marketplace outreach and other things like that. So we're huge believers in data visualization and transparency. As I said, we've released a slew of extremely raw data. We've also aggregated some of this data into kind of fun dashboards. This is a dashboard that right down to the county level shows chronic disease prevalence among the Medicare population. The bubbles at the bottom tell you the number of beneficiaries, looking at chronic disease prevalence and overall Medicare spending. The bubbles correspond to the number of Medicare beneficiaries in a county in Florida. So again, a very quick way for a caseworker or somebody on the ground. It doesn't have to be these particular variables, but it shows that sure, you got this little guy right over here, but maybe you should be focusing your efforts here and here because that's where the most bang for your buck is. With the Part D data release that we did, just to highlight two, I think very intriguing examples that have very direct implications for how CMS interacts with physicians as payers, Part D plans, and even beneficiaries. Very high very high geographic variation in generic dispensing rates by possible referral region or county. So that's an area for improvement, and also opioid prescribing. While The national average is 5.3%, but you can see it ranges from a low of 1.8% to a high of over 9%. So Miles mentioned real-time system monitoring. Got a couple of examples of that here. There's been a lot of talk about Hep C drugs, and so we monitor that on a daily and a weekly basis. We have the ability because the data hits our system in that way. And so a lot of talk about Sovaldi, but I think the really interesting thing is Harvoni came along late last year and totally blew Sovaldi out of the water, and B, interesting. Temporal differences in when both physicians and patients choose to receive care. So you can see the dips around major holidays and different things like that. Obligatory, this is a lot of money and a lot of spending, but this is a very important drug and a true life-changing intervention for a lot of people. We're also tracking Medicare fee-for-service readmissions in real time. So we've been able to track the decline and then the kind of at least initial leveling off in that decline, but we have lost over a percentage point to the average readmission rate. That's 150,000 fewer readmissions. So again, it helps us understand how our programs are working. That's just a kind of a geeky graph. One thing that was, again, I think the power of analytics, like question begets question. And so when we initially published and released our information on declines in readmissions, frankly, a lot of people scoffed and was like, well, it's observation stays and ED visits and people are gaming the system. Well, the beauty of analytics is that you can answer all these questions. And when we looked at these questions, we found that in 2012 and 2013, apologies for the slightly dated nature of this slide, that the decrease in readmissions was actually vastly outweighed any increase in observation stays or ED visits. So I know I'm giving the person in charge of timing this event fits, because I was told to wrap up about 2 minutes ago. My excuse is Miles also went over time, so I think he cut into my time a little bit. So I'm just, she said that's true. Just another cool visualization. Again, this is very practical. This is not just a pretty map, right? Readmission rates are declining, but they're not declining everywhere. So in the areas, and we can drill right down to the hospital, right down to the local area. Why are they increasing? These are the kinds of questions that we're asking ourselves. And then we have a series of maps. I really wish I could show you more fun marketplace open enrollment statistics. Unfortunately, a lot of it still has to be cleared, but we're doing a ton of work around that, looking at plan switching behavior, special election periods, outreach strategies. As I said, you can see where people are. Yeah, California and Texas are big states. I get it. You can see where we're attracting more new people, and then you can see where the majority, where you're more likely to receive APTC and CSR amounts. So I think that's it. I will stop now so you can breathe. And again, I hope people found that helpful, and thank you very much.
Thank you, Miles and Niall. As the panelists are transitioning, I'll just go ahead and introduce the members of our first panel. We have Stuart Buck, who is Vice President of Research and Integrity at the Laura and John Arnold Foundation. Jeff Alou is Associate Director of Health Research and a Senior Researcher here at Mathematica. David Weaver is the Associate Commissioner for Research, Demonstration, and Employment Support at the Social Security Administration. And then finally, Irma Perez Johnson is another Senior Researcher at Mathematica. So with that, I'll hand it over to Stuart Buck, who will be moderating this second panel after he gets mic'd up.
Okay. Thank you for being here today. I'm glad to moderate the session on analytics in action. So as she mentioned, my name is Stuart Buck. I'm the Vice President of Research Integrity at the Laura and John Arnold Foundation in Houston, Texas. A brief note to the webinar audience. You are not bound by the conventions of normal question and answer sessions. You can submit your questions or your comments phrased in lieu of a question in the chat panel at any time. So I'm going to give just a brief opening remark and then kind of turn over to the panelists to introduce themselves. My general view is that there's lots of potential in predictive analytics, but I'm interested in the distinction between prediction and causation, because it seems to me that a lot of the examples of predictive analytics that I've heard about or that we've seen depicted are basically descriptive statistics or kind of maps. Sometimes I've heard about it being addressed to what seem to be rather simple causal problems, like trying to predict where potholes are going to occur, or where house fires might occur. Mike Flowers in New York City likes to give that example. But it's less clear to me how this applies or what to do with situations in the social sector where you have complex causal mechanisms that aren't fully understood, that are plagued by unobservables and selection bias and confounding factors that are hard to control for absent some sort of exogenous variation. So take, for example, the attempt to predict high school graduation rates by looking at someone's 9th grade career in school. So you want to predict whether they're likely to drop out. And let's say, hypothetically, you find that someone who makes 3 Fs in 9th grade is really likely to drop out. And that's interesting, but it only gets you so far. I don't think it tells you anything whatsoever about what sort of interventions you might want to target at those 9th graders. They might be, frankly, hopeless. There might be nothing you could do. They might be beyond repair at that point. That's a rather discouraging and cynical view, but I'm just saying that's a possibility. It might be that you want to target academic interventions at them. It might be that their problems are very extensive and involve abusive, alcoholic families. It might be the problems with their neighborhoods. They might need to be moved to different neighborhoods. There are all kinds of solutions that one might want to try out, and I'm not sure predictive analytics would tell you what sort of interventions to try out, nor would it necessarily be able to provide that sort of exogenous variation that would allow you to determine causation. So that's just kind of a cautionary note on my part. So anyway, I'd like to turn it over to the panelists here just to introduce themselves by giving your name, affiliation, and a sentence or two on these sort of analytic questions that you're working on.
Okay. Thank you, Stuart. My name is David Weaver. I'm the Associate Commissioner for Research, Demonstration, and Employment Support at Social Security. And I appreciate your remarks as well as Miles, which kind of, let's put some structure around what data analytics are. And my shop has, at Social Security, has a number of quantitative analysis that we do. Some of it seems to fall more into the analytics category, and others falls into the research or causal testing of projects. So a couple of things we do in the analytics area, I think, that are close to that. My shop has responsibility for identifying fast-track disability decisions. We have statistical modeling where we try to identify individuals who are very likely to be approved for a disability claim and for which we can work the claim quickly. We do a fair bit of modeling on predictive modeling to try to improve program integrity issues. We look at issues related to trying to identify cases where you may have overpayments or underpayments in the program and to work those quickly before they get out of hand. We also have a fair bit of modeling in terms of the return to work space, where we're looking to try to identify individuals who might benefit from some of the employment support programs that the Social Security Administration runs. So that gives you a little bit of a sense of our shop and the role of analytics, in addition to the sort of longer-term research projects we do.
Good afternoon. My name is Jeff Alou. I am an Associate Director of Health Research here at Mathematica. I also lead our work joint with Northrop Grumman to support CMS's Physician Payment Modifier Program, which provides estimates of, or develops estimates of quality of care provided by physicians and the costs associated with providing that care. We use those estimates to then adjust physician payments and also provide them back to physicians along with detailed supporting data in the form of confidential feedback reports. Time permitting, I'm also going to speak a little bit about some of our other value-oriented work, which includes, among other things, supporting multiple performance-based reporting and payment programs, actually both for hospitals, and also some of our work assessing the value of teachers and how much they contribute to the value of their students' education. The common thread tying all three of these strands of work together is that they're very high-stakes initiatives that are value assessments are used to drive decisions that affect individual physicians and teachers' lives, for example, their incomes or their reputations. And so when we do this work, we have a very special responsibility to do it right.
Good afternoon, everyone. I am Irma Perez Johnson. I'm an Associate Director of Human Services Research with Mathematica Policy Research out of our Princeton office, and delighted to be a part of this panel and to have the opportunity to tell you all a little bit about the work that we're doing in partnership with the U.S. Department of Labor to test behavioral interventions, behavioral enhancements in the context of our programs. This is slightly different than I think the work that some of the other panelists and some of the other speakers you'll hear about today. It's perhaps a little less ambitious in the sense of the full data analytics sense, but what the project is really trying to do is demonstrate the potential to leverage existing data systems and the infrastructure that increasingly is available in the context of social policy programs to identify small modifications to the programs that can actually then be rigorously tested, leveraging those existing data systems. So our project is a 3-year effort in partnership with the Chief Evaluation Office. It does incorporate this idea of behavioral diagnostics to identify potential causes for the reasons why the various targets of labor programs fail to engage in the desired desired ways, why people fail to respond to outreach efforts, why they fail to fully engage in persistent employment programs, why employment agencies or employers fail to respond to offers of assistance around safety and health regulations and the like. But again, we're partnering closely with the U.S. Department of Labor agencies to identify opportunities to test potential improvements to their programs to address those kinds of concerns in a rigorous way.
Okay, so I have a few questions that we've all kind of agreed to ahead of time for the panelists. So we'll start with David Weaver. So what are some ways that your agency is expanding the use of data analytics?
Thank you. Got to work the mic correctly. There are a couple of things I'll mention. One is my agency recently released a strategic planning document called Vision 2025, which is sort of a longer term where we want to be 10 years from now. It does just talk about the role of analytics, so I think that's a good way to kind of frame the answer here. I think what you'll see is a lot of focus on analytics used in what I'll call program integrity issues. That could include identifying overpayments or underpayments in the program. Those are not necessarily related to anything like fraud, for example. They may just be information that we didn't receive in real time. But there is also an interest in anti-fraud efforts. The agency started a new office focused on to minimize fraud in programs. It's not common in our programs, but we're sensitive to the reputational effects of it, so I think you'll see a lot of energy in sort of the program integrity space. There is also, I was intrigued by the comments from CMS earlier, there is a lot of interest at SSA in terms of thinking about who our customers are and what their preferences are. In terms of the service channels they like. Some people actually like to show up in person to file a claim. Others prefer the internet and others phone access. But that's just one dimension you could think of your customers having preferences on. So I think you'll see a lot of activity around trying to determine what our customers' needs are and how we position ourselves to address that.
Do you see any trade-offs in trying to ensure that quality analytics are accessible at the time that decision makers need them?
I think there are some trade-offs, and I want to mention at least 2 or 3. One is there's sometimes, and there's a lot of focus here today on sort of the use of administrative data and data analytics. So these are administrative data or the data the agency possesses on its beneficiaries or claimants if they're filing for Medicare or Medicaid. But there has to be some attention paid to this notion of, is the data nationally representative for the discussion at hand? So we may have very good data on people who are currently in the program, but you often have to use other data sources if you want to talk to people who are not yet in the program. And typically we've done that through the use of household surveys that are built by the Bureau of Labor Statistics or the Bureau of the Census. And the reason I mention that just as a general topic area is I think you have to be a little careful about just because you have data on some part of the population in some form, it doesn't mean it represents the general experience. But I think there's always a tendency, well, we've got something, let's go with that. So I think that's a caution area for the quality of the data. I think the other point is the one you kind of raised earlier. What are the causal factors driving the outcome? So you can do a lot of analysis looking at two variables or something, and you could leave the policymaker with the impression that you've identified the cause of a certain thing, but I don't think that's really where you get, really where you need formal statistical modeling to get a good answer. And I think where I see data analytics, its real promise is identifying very anomalous outcomes. So if you're looking at rare or very strange outcomes, often you can immediately determine what the cause is. So I think you have to be a little bit careful about its application.
Right. But moving on to Jeff. So in what ways do you see value measures as being important, but also sometimes tricky?
Thanks, Stuart. Well, I think value should be important to folks whenever we agree that we've got the need for improvement in health care or education or something else in a cost-constrained environment. Okay? So to use an example that I think this group is probably very familiar with, if in the absence of significant reform, health care is going to chew up $1 out of $3 of federal spending by 2039, which is going to crowd out other priorities. So we all know that we need to get costs down, or at least their rate of growth down. But you don't want to do that by compromising quality of care. So the problem that you're really trying to solve is you really want to improve or at a minimum maintain quality of care while at the same time reducing costs or the rate of cost growth. And that's fundamentally a value problem, and it's a pretty important one. In terms of why value can be difficult to assess, we do have a slide. If we can go to the next slide. I'm not going to go over all these numbers. It should be in your packets or online, and the font's a little small. But the purpose of this slide is to give you some sense of the value assessment process for our physician payment reform work. And I'm going to go through the challenges of assessing value using this as something of a case study. And if you start with that first column there, you see that the first thing we do is we take in and review huge amounts of complex data. And as anyone who has ever worked with complex data knows, those are rife with, to piggyback on a remark from just a minute ago, anomalies and exceptions. Okay? And you need to account for those anomalies and exceptions when you do your individual value assessments. Otherwise, you're going to get some of them wrong. And if you get, as will often be the case for a typical anomaly, you might get a value assessment wrong for 10 or 20 physician groups out of more than 160,000. Okay? But that's going to have a direct impact on those groups. So this is echoing one of Niall's remarks from earlier. They're not going to care that you got the remaining 99.9% right because you got them wrong. Okay, so you need a pretty sophisticated process for going through large amounts of data and figuring out where the relevant anomalies and exceptions are and then being able to correct and accommodate them. The second column suggests a second challenge. Our code is pretty extensive in part because it needs to accommodate these complex data. And it also needs to accommodate some pretty complex program rules under which we operate. And yet we don't have very much time to actually execute the value assessments. All right? So from the time we get our final physician data, we have 5 weeks to turn around accurate value assessments and all of the detailed supporting data that go with that to physicians. That's not a lot of time to do a careful job, and we know that here as anywhere else in life, when we rush, we make mistakes. So a second challenge that we have is how do you be efficient and nimble without rushing? There are also challenges associated with customization and complex methods that I won't get into, at least right now in the interest of time. But suffice it to say that we have challenges to assessing value properly and corresponding risks to quality throughout the entirety of our value process.
So you may have already touched on this a bit, but the next question was, what steps do you take to ensure that the measures are high quality?
Right. Well, we have a number of processes that we've installed, and I'll just touch on a couple of them. The first is that not only will we do a quality review of our data, our logic, our code when putting together value assessments, but we will also review the upstream data that feeds into our process. For the obvious reason that we can do our value assessment perfectly, but if we do it with wrong data, the value assessments are still going to be off, and that's going to be a problem. Another thing that we do is we triage risk. We have enough experience with this work at this point that we can get some sense of what areas of our code or logic are likely to be troublesome. And those are the places where you want to direct a disproportionate amount of your quality review firepower. Those might be late changes in requirements. They might be particularly complex formulas. And we actually had a series of complex formulas a few years ago that we knew were going to be really difficult to get right. And so we put 5 senior reviewers on that, and the first 4 said no problem and signed off, and the 5th one found an error that we were able to correct. And we were able to find that because we knew where the complexity was, where the likelihood, and where the risk was, a high risk was, and we targeted that. And then one additional thing, I'm not going to go through the whole litany here, but I indicated previously that we don't have a lot of time to do this stuff. So how do you deal with that? One of the things that we do is we work with our very good data partners to get highly functional test data as far in advance of the development process as possible. And then we review those test data as if they're live. Okay? And that means that we confirm that any anomaly that we find is due solely to the test-driven nature of the data or not. Once we've done that, we can develop the vast majority of our code with the test data. Another thing that we do is we invest in efficiency. We had one coding module that last year took 50 hours to run. This year, thanks to a lot of programmer creativity, we're down to 9 hours. That's a huge amount of time when you're talking about doing final runs and quality reviews in about 5 weeks. Okay? The purpose of all of this, working ahead with the test data, of course, and investing in efficiency is, again, we're trying to solve this problem of how do you be efficient without rushing. Okay? And so if you don't need to be developing code once you get those final data, if you don't need to be spending time running code, or as much time running code, once you get those final data, you can spend that time doing what matters most, which of course would be more quality review.
Let's move on to Irma. So how do DOL experiments differ from the types of experiments that Mathematica has already been involved in for years?
Thank you, Stuart. So that's, I think that's a really important question. And first I want to clarify that, the Department of Labor has been a long-standing client of Mathematica and has been part of the long tradition of doing the more classical experiments that perhaps are like the bread and butter or like the most well-known part of the work that Mathematica does. And second, obviously, as you've heard, Mathematica now does a wide range of different research studies. But I'm certainly very familiar with the more classical experiments that perhaps many of you will think of when we talk about randomized controlled trials. And I would highlight what I would think there's 2 important differences to highlight about these like rapid cycle behavioral trials that we're working on now with the Department of Labor in contrast with these other more classical experiments. The first is that for the most part, we're testing relatively modest changes or enhancements to existing programs. Things like redesigning program communications, adding a handout with clear action steps to sort of try to prompt people to be more likely to follow up on anticipated responses, adding reminders of motivational messages in order to get people to actually engage more strongly with the program and persist over time, to see if these types of changes make it more likely for participants to take up services, to persist in a program, or to follow up in the desired ways. The more classical experiments that I think most people will think about tend to be randomized studies of a whole new program. The second difference is closely related to the first, and it has to do with the types of data and the types of resources that go into doing these kinds of evaluations. in the context of a traditional experiment, typically there's a whole new deployment of data collection systems and infrastructure that has to be built. In the context of these behavioral trials, we're better able to leverage the existing systems and the existing infrastructure in order to deploy these experiments and these little tests very quickly and learn their results. And then that makes it possible to do more tests on an ongoing basis.
So would you say that this work folds into an ongoing continuous improvement process, or it's going to be just embedded within the system on an ongoing basis?
Well, certainly, that's the hope. I think that the potential is definitely there because of the work that we're doing with our partner agencies within the Department of Labor. We're certainly helping demonstrate the potential for them to leverage their existing data systems, identify small tests that are actually of interest to them and they really think can improve the performance and operation and outcomes of their programs in meaningful ways. And also we're helping build capacity within these agencies to continue working and doing these kinds of tests after partnering with us. Clearly, as I mentioned earlier, the tests that we're doing incorporate this behavioral diagnostic step in order to inform the kinds of solutions that get tested. But it's, in my view, that's not necessarily that's not a necessary condition for doing these kinds of embedded experiments in the context of an ongoing program. One can envision testing a planned policy change in a limited way using rigorous methods, alternative approaches to service delivery, or program enhancements like we're doing in the context of these experiments.
Great. So I think let's move to the question and answer session. So we look forward to answering as many of your questions as time will allow. If you have a question, please be sure to state your name and affiliation first. And for those who are in the room, please speak into the microphone. I'm not sure where that is. There. It's holding it in the back. Speak into that microphone so that the webinar audience can hear you. And please limit your comments to one actual question. Anyone who attempts to filibuster will be escorted from the room by security. For those attending online via the webinar, please continue to submit your questions via the question and answer panel there, and we'll try to get to those as well.
I'm Clint Brass from the Congressional Research Service, but I'm speaking just for myself, not for my agency. Question. So in the setup, you talked a little, or the earliest presenter talked about data analytics being for decision support, but I'm hearing a lot about learning too. And in the literature out there that I see, there sometimes is kind of a rhetorical bias towards, well, this needs to be useful immediately for decisions, but can you talk about tensions between a learning agenda, decision-making agenda, and how you manage clients and audiences within your agencies and outside your agency?
Sure, I'll mention just a couple of things. One is sort of in our fast-track modeling where we've tried to identify individuals who we believe are very likely to be approved and we can make a decision quickly. Initially, you might only be able to look at a small subset of cases, so it wasn't built in just one day. And there is kind of a tolerance, I think, for to make sure things work, and then over time to improve or expand models to include more cases. So I think in terms of the kind of culture of around this, I do think people recognize that you may have to start small and kind of grow into something fuller. So some of the data analytics we have, they weren't fully mature from day one, but they kind of got to that point at over several years. And I think my experience is there is some recognition and tolerance of starting out a little bit small and moving to the mature models.
We have a question from the webinar audience. Kind of goes at the question of our kind of standard evaluation with random controlled trials versus the use of big data. And it's a specific example of work Mathematica has actually done. So as a report Mathematica shared on transitions from school to work, which was the SSA youth transition demonstration, showed that the treatment group was not especially effective, at least not across all sites. Can you instead use big data to see what the areas that have relatively high employment for people with disabilities have in common? So it's a very kind of specific question, but it's the use of data to kind of get at this larger issue as opposed to an experiment.
Should I go first and then
Go
you can?
ahead. Yeah,
Okay,
please.
so the youth transition demonstration, that was a project our agency ran to try to give services and incentives to young folks with disabilities to make them have successful transitions into adulthood. Not all sites had the same effect, but I do want to mention something. The final 3 sites actually showed pretty strong effects that we found when you do provide aggressive job placement services to these young folks. The treatment group experienced much, much higher rates of competitive employment than the control group. In terms of whether we would use a formal demonstration like the youth transition demonstration to identify ways to reach this population versus big data, that's a good question. I think, and it comes back a little bit to my notion that a lot of what the good analytics would be to identify very special or anomalous behavior. So if you looked at across the entire U.S., you might detect that there are certain areas that have very successful or large numbers of youth with disabilities transitioning to employment in adulthood. And that gives you a theory to further test why did that happen. But I don't think they necessarily exclude each other. The demonstrations are sort of formal hypothesis testing, and kind of the big data or just examining across the U.S. as a whole might give you some theories or hypotheses that you might want to test.
Yeah, I'm not fully familiar with the youth transition demonstration, but I think I would completely agree with your remarks that sort of big data can still play a very informative role, or these kinds of data analytic techniques in helping understand the problem, helping understand, like you were saying, the types of programs or approaches or industries and strategies that may be more successful in helping youth make this transition successfully. At the same time, I think you still need to, then going back to Stuart's question at the beginning of the panel, test whether particular strategies, to then help youth enter into those kinds of occupations or industries would be successful in helping them make that transition effectively. And for that, the traditional, the classical randomized controlled trial is the best way to test objectively whether a particular strategy is effective or not.
Good afternoon. I'm Bill Bain from the Agency for Healthcare Research and Quality. Starting with Dr. Mayfield's talk, we use analytics as a singular noun. And I wonder what the difference is between analytics and analysis, what the plural of analytics would be, and what the appropriate adjective for analytics would be.
Tackle that.
I was not an English major, so it's a good question. I'm going to punt on that part of it. The one thing that I can say very briefly, though, that's an analytics focus of us, just to sort of reiterate where I started, is that we are very interested in taking the gentleman from the Congressional Research Service's point as notwithstanding, we are very interested in providing actionable information to physicians and physician groups. And so a real focus of what we're doing is, with analytics, is to not only figure out what happened, but what will happen, what can happen, if we give you information that's useful that can allow you to, in the case that I was talking about, improve your physician practice. Whereas analysis, I think of as perhaps something that might be a little bit more broadly construed that doesn't always need to drive that decision making. Again, I'll punt on the adjectives and so on.
And there are a number of disciplines that have a putatively plural form, like economics, statistics, physics. So in this case, perhaps like the term data science, it's just something that's caught on and is trendy. So that's the term we use. Okay. That's my theory. Any other questions from the web audience? Okay.
Yes. Can you discuss some strategies or suggestions on getting management involved and interested in making decisions based on data?
It's a good question, and I think it was somewhat addressed in the first session, which is I do think if you're talking about senior officials within the government or business or anywhere else, there's a real time constraint. They also have to make decisions by a certain deadline. So you don't get to say, well, we'll get you the answer when we're ready. So I think the solution to that, to the extent that you can kind of bridge that, is really sort of to be able to put information that's easily digested. And I really like some of the charts I saw in the first session where you can immediately see the large bubbles versus the small bubbles. So graphics help a lot, but something where you can engage them almost immediately.
I was going to say that based on our experiences in this behavioral interventions project with the Department of Labor, one thing we have found is that just starting with a problem that is a real concern, sort of to your agency partners, to your administrators, is critical. And that's always our starting point in the context of our work. We start with a problem that they care about, an area of program performance where they would really like to improve, and then work hand in hand with our partners to try to understand that problem and figure out potential strategies to help them improve in those areas.
Yeah, I was going to add almost exactly the same thing, that when you hear the word analytics, I think to me at least, perhaps it shouldn't, it conjures images of computers and automated processes, and there's a temptation to leave the very human element of that behind. But I think if you want to imbue your analytics with meaning, you need to be very good at listening and listening up front to what the decision maker's needs are. And if you're doing that, it's going to come very naturally to them when you give them a tool that in some sense they help to build. That's going to imbue it with meaning automatically.
All right. I think there may be a few questions remaining, but in the interest of getting back on schedule, it is now time to ruthlessly cut things off. So I'm going to adjourn this panel and turn things over next.
Thank you to... Sorry. I just want to thank our first round of panelists, and while the others are getting situated, I will introduce them. As moderator, we have J.B. Wogan, a journalist from Governing Magazine. Joining him is Jennifer Brooks, who's director of the Economic, Human Services, and Workforce Division of the National Governors Association Center for Best Practices. And Scott Cody is vice president and director of program and policy experts in Mathematica's Data Analytics Division. So thank you, everyone, and we'll get started on the analytics frontier.
All right. Well, thank you everybody for coming. I'm looking forward to this session on the analytics frontier. My name is J.B. Wogan. I'm a staff writer at Governing Magazine. For those of you who are not familiar, Governing covers state and local government around the country. Our audience tends to be practitioners, governors, county executives, mayors, and their staffs. And you can look us up online at governing.com, which I only mention because we have a data page, and we actually, despite having a small staff, have a data editor whose stories almost always start with some sort of a public database and him interpreting trends. So like the last panel, instead of introducing each of you, I'll ask you to each say a little bit about yourselves, provide your name, affiliation, and a sentence or two about the kinds of analytics that you guys are working on. And a note to our webinar audience, you may still submit your questions to our panelists in the chat panel at any time. Jennifer, do you want to start us off?
Great. Thank you, JB, and thanks to Mathematica for having me here. So I sit in the Center for Best Practices at the National Governors Association, and the Center for Best Practices provides technical assistance and resources and supports to governors. I'm not obviously here representing the 50 governors, but I can tell you a little bit about some of the work we're doing with governors around the use of data and evidence. And this is a strong focus for us right now in NGA. Our current chair is Governor Hickenlooper of Colorado, and as part of being a chair of NGA, you get to work on an initiative of interest to you, and Governor Hickenlooper's initiative is entitled Delivering Results. And it's all about improving the effectiveness and efficiency of state government. It includes many things, but some of which include the topics we're here to talk about today. At the same time, we have some resources from the Arnold Foundation to think about building in better use of data and evaluation into state government. So we're doing a lot of thinking about what governors are currently thinking about, how states are using data, and how we can build capacity. I am an evaluator by training and have a very strong interest in bridging this gap. So, you know, most of our conversation really does start sort of as the panel before talked about with what is the question of interest to the governors, to the states. And one of the exciting things, I'll talk about it a bit later, is just, you know, when governors think about results, they don't think about program streams. They think about outcomes that they want for their citizens. They think about a strong economy. They think about an effective workforce. They think about healthy and happy families. And you know, some of those broad outcomes drive some interesting thinking about how you put data together across multiple agencies and use predictive analytics. And so I'll speak a bit about that as well.
Thanks. Yes, I'm Scott Cody, Vice President with Mathematica's Data Analytics Division. And when I think about sort of the analytics frontier, I'm thinking about what are the tools that we can use to leverage the vast amounts of data that we're going to have from public programs in probably the not too distant future. So, data from eligibility systems, that we already have, data from transactional systems, data from assessments that programs are administering to their participants is just sort of the starting point. We will also have more data as programs start to link their administrative data systems across programs. We will have data from, we already are seeing data from, when and how individuals are interacting with online eligibility systems or online benefit systems. And we'll also be, having access to data from technology, in the education sphere, curricula delivered through Chromebooks or through tablets, in the health sphere, electronic health records. This is all information that can be made available to help make better decisions, to help program administrators make their programs more efficient. And one of the things that we've been thinking about at Mathematica are, so what are the tools that are available currently, but that can be used really to leverage these greater amounts of data. And I will mention two, both of them have already been talked about a little bit today. One of them is rapid cycle evaluation. Irma talked about that in the context of, testing nudges in a sort of very specific context, which is a valuable tool. But I think that there's potential for agencies, and Irma alluded to this as well, for agencies to kind of embed this process into their operations in a kind of continuous improvement way, so that they're potentially running, dozens, maybe even more experiments a year on their operating procedures, on their policies, on their regulations, and getting feedback right out of their administrative data to figure out what's making their programs more effective, what's making their programs more efficient. And then the other tool I'll mention, which has come up a couple times, is predictive analytics, which can allow programs to identify or anticipate the needs and behaviors of program participants and really use that to help them target limited resources in a way that can hopefully improve outcomes for program participants. So I think a good example here is a health example with the Medicaid program. It is possible to predict which expectant mothers on the Medicaid program are likely to have a high-risk pregnancy, preterm birth, low-weight birth. The baby could end up in the neonatal intensive care unit. And if you can predict which mothers are going to have these high-risk pregnancies, you can then target resources to try and mitigate that risk. And that can improve health outcomes for the mother and for the baby. And at the same time, if you're preventing a visit to the neonatal intensive care unit, you're saving the Medicaid program significant amounts of money. That question came up about, I think it was Stuart who raised the question about causation versus prediction. And in this case, you're not getting at the what's causing the high-risk pregnancy, but you're using the prediction really to target what the agency's limited resources in a way that can generate the most benefit.
Thanks. Hi, everyone. My name is Mark Peterson. I work at USAID, the U.S. Agency for International Development. Our mission is to reduce poverty, it's to improve health, it's to strengthen democratic societies. And my work within USAID is to lead a team focused on finding innovative ways of applying data and analytics to that mission. And it's really all along the data value chain that we're looking to find those innovations. It's in how we're generating data, either about the challenges that we're facing or about our own programs. So, for example, using cell phone linked sensors on wells that we put in villages to understand if they're still working or if they're not, if nobody's using them. It's in how we're sharing data, so opening up our own data sets, engaging others to turn that data into insights. It's in how we analyze it, and it's how we apply the insights that we generate from that analysis to make decisions, and how we empower others that we're partnering with to make better decisions based on that data. And so right now there are a slew of things that we're sort of investigating and piloting and scaling up within the agency. Just a couple of quick examples. Novel uses of satellite imagery, using social media analytics, using futures analysis, which is focused on long-term trends and how that should drive our programs and our strategies. So I'll stop there in the interest of moving things along.
All right, so I'm going to start with a question for you, Jennifer. So in our last panel, I think one of the webinar questions was about how you sort of convince managers to be interested in collecting and analyzing data. And the answer was you have to be listening to what the decision makers need. So when you're interacting with the highest level decision makers at the state level, governors, what are you hearing from them? What are common messages in terms of the areas where they need better analytics?
So, I think the answer to that question on the last panel was exactly right. Of sort of, and I want to use it actually to highlight another question, which was this: what is analysis versus analytics? When I'm a researcher by training, and when I first heard people talking about analytics, I was like, what are you talking about? I actually was talking to somebody, I was detailing at OMB, and this woman was talking to me, and she's like, I love regression analysis. And I'm like, well, that's an odd, I really love correlations. I mean, it's just but over time, I've come to realize that actually this is totally reframing the way we think about data and the use of data to be more about management. And less about, it's a more dynamic relationship to data and the use of data than our traditional models of research and evaluation. It doesn't exclude the need for RCTs and other things, but it sort of moves this into the hands of the managers, and that is extraordinarily powerful. I'll talk about, so Governor Pence had a strong interest in reducing infant mortality in Indiana. There were high rates of infant mortality in Indiana, and he took this on and said, this is going to be my priority. We are going to get this down, and created a team of folks who worked, I think tirelessly to put together data across something like 50 agencies to start saying, how do we better understand the problem and figure out where to target our efforts? And, wound up sort of saying, okay, the key predictive indicators had to do with, individual mothers who were not on Medicaid, who were not able to make it to their prenatal care appointments. And so now what do we do in reaction to that? And then you can go implement a new intervention. But it was driven by the priority of the governor, which was around reducing maternal infant death. I think another area that governors, that I'm hearing discussion about predictive analytics has a lot to do with exactly what Scott said of, really targeting scarce resources. We're in a place, particularly in Medicaid, where the budgets for healthcare are sort of squeezing out availability and resources for everything else. And so there's a lot of interest now in understanding sort of the 80-20 issue, right? The 20% of the population that's driving 80% of a cost. And this is a place, I think, where predictive analytics is really starting to come in and say, okay, here is how you can identify who that 20% are so that you can get much more serious about targeting resources to them. And then what's exciting is actually those are facilitating some of these cross-silo conversations, because then it's saying, okay, well, you know, in a lot of cases, these families have mental health issues or the parent needs a job. And so it's pushing us to say health isn't just driven by systems that touch healthcare. It's also other factors in the community. So let's bring in the human services advisors and such. But fundamentally, it has to be driven by the needs of the people you want to use the data. In this case, governors. But I think the shift from our standard approach to research and evaluation to thinking about analytics is one that is just a fundamental democratization of thinking about data. And then it's on us to make sure that people understand what you can and can't do with it. And that it doesn't mean we don't need rapid cycle evaluation and other methods, but it really is a targeting in a world of scarce resources tool.
Oh, thank you. All right, great. So I have a question for Mark. We just got the state perspective, but from a federal perspective, what do federal agencies need to do to be kind of leaders, or what does the federal government in general need to do to be a leader in better data analytics?
So I think that's a great question. I think there are kind of two ways that I would like to see U.S. leadership manifest itself in data and analytics. One is something I think we already do very, very well, which is to move forward and raise the bar on data science and analytics broadly. And I think we're doing an excellent job of that. We've got top flight universities, we've got innovative private sector companies, we've got a large, relatively data literate population that's sort of feeding some of the demand for this. I think where there's a lot of opportunity for us is in the international sphere. So USAID in particular, we work in a lot of very low resource environments. We work in a lot of environments where there isn't that capacity necessarily for data analytics. There isn't that access to data. And so for us, what I would like to see is the U.S. step up and very purposefully and specifically engage with other countries, engage with their governments, engage with their civil society organizations, engage with their citizens to build that capacity to analyze this data, to apply it. So, I mean, if you're in a small rural village or if you're in a town, in a lot of places where we work, they're not necessarily going to have the folks who can look at, you know, records of local rainfall and turn that into a plan around how they're going to deal with access to drinking water over the next 10 years, right? And so I think there's a lot of opportunity for us to help build global standards and norms and best practices around data. And, you know, that could be, for example, privacy, standards around privacy. What's sort of the way of handling that? As well as to step in and partner to build capacity to collect and analyze that data. And that could be partnerships through university partnerships that we facilitate. It could be directly working with local or national governments to build their capacity to actually use this data. So I'd love to see us engage more there.
Just as a follow-up, is there anything, I mean, so you're talking about sort of in the developing world context with USAID, but I'm just wondering, are there any kind of universal vagaries that you've encountered so far in terms of trying to actually take data analytics or analysis or however you want to phrase it, but actually use that in your daily work? I mean, are there certain things that have been kind of institutional barriers to that so far?
Yeah, certainly. So I think these are probably broadly experienced across the federal government, probably a lot of other organizations as well, but I think being able to handle that data, in other words, being able to store it and share it and make sure people know what data is there and know why it's useful. I mean, I think those are things that sort of, internal IT departments think about, internal, CIOs' offices think about. And then there's also the piece of actually having demand for that data and demand for the analysis on that data. And so that was something that we talked about in the Q&A in the last panel. How do you actually create that appetite in decision makers to take it and do something with it? And so that's been answered by many, many people. I don't think I need to rehash that, but there are a wide variety of tactics, I think, to make sure that that happens. But I think always implemented according to the particular challenges of one organization.
As we're having technical difficulties behind us, but fortunately we don't have too much use for the screens right now. But all right, so this is a question for any of you to take up, but maybe you guys could just define for a second what is big data in a government context, and how can public agencies use it to make programs run better?
I don't know that I've found I don't know that I've heard a satisfying definition of big data. I do think a lot of the large data sets that we work with in the kind of social policy realm, to call them big data is sort of like Starbucks calling a medium a grande. But I think that there are data sets that we're working with. I mean, Jeff, I don't know if you'd call the amount of data that you're working with to do your work big data. It's getting there. But I think when I'm thinking of federal agencies that have big data, like National Weather Service, the Fed, these are agencies that have massive amounts of data on a daily basis flowing through. And I think one question for us in kind of the social policy realm is, at what point can we leverage those data? At what point does weather factor into a predictive model for some social policy outcome? I don't have a good example of what that would be, but as our ability to sort of process large amounts of data increases, our ability to tap the potential of some of these actual massive daily data sets, I think increases.
I'll just say as well, I mean, I think there, particularly at the city level, I think there's some thinking about how we tap some of the things that I think are traditionally thought of as big data in terms of, the data from Facebook and the data from Twitter and what have you. I've heard folks talk about, can you use restaurant reviews to help target how food inspectors go out to restaurants, and so there are some places, and I think as we get further along, I mean, it's funny, we always get into this quality question, and one of the struggles I have is that it feels like a little bit of a chicken and egg. We're moving government systems from fundamentally a compliance orientation when it comes to data, right? They collect data because somebody told them they have to collect data, to how do you need to use data and what do you need to do with it? And that is that's not an easy conversation. I think the relationships matter tons here, being able to speak that language. But I wonder if the next frontier won't be starting to say, okay, now what are the other kinds of data that are out beyond our walls of the federal or state or local government that we can tap into to make this more useful? And sometimes it's happening across levels of government. So, getting access for states to SSA data, or, starting to really break down those barriers to different types of data across levels of government and across types of data to make these analytic models even more powerful.
I think one of the areas of applying big data that for me is very exciting in terms of improving our programs is kind of keying in on, if you look at the, one of the standard definitions of big data, it's the 3 V's. One of those is velocity, right? And so looking at some of these large data sets that are coming very, very quickly, it's kind of real-time data, right? So it's what are people tweeting? Are there, how quickly can we get satellite imagery that's updated? And I think there are all sorts of opportunities to start using that velocity V to turn our programs into programs that are managed much more closely to real time, right? Whether that's being more responsive in starting up a new program, so or starting up a response. So, for example, just to give a real quick example, in Indonesia there are more Twitter users than in any other country. More Twitter users in Indonesia than in the U.S. And so we can use what people are tweeting potentially about the price of rice to say something about food security issues before we would normally be able to get that through surveys or looking at market pricing. We may be able to use satellite imagery that is updated now once every 24 hours, once every 48 hours, to start looking at, are people illegally logging, and what is that doing to deforestation, being able to respond quickly enough to actually use that sort of information in our program instead of 3 months later. And so, I mean, those examples are specific to international development, but I think keying in on that V around real-time data can make our programs much more agile and much more adaptive in how we're managing them.
All right, that actually is a good dovetail for my next question, which is about rapid cycle experiments, which, Scott, you had referenced and has been referenced a few times in previous panels. But maybe you could just explain what a rapid cycle evaluation is, or experiment is, and maybe how it actually works in the real world.
Yep. So rapid cycle experimentation or rapid cycle evaluation is really about testing changes to program operations and procedures to see if you can improve the program effectiveness, improve program efficiency, looking at either the targeted outcomes for the program or for proximal outcomes for the program. And I think that there's potential for agencies to really sort of adopt this into a kind of a continuous improvement framework. And I can give a quick example. One program that I have worked a lot with is the SNAP program, Supplemental Nutrition Assistance, or the food stamp program. And SNAP is a federally funded program, but it's administered by the states. And when states are administering SNAP, they're trying to maximize a number of objectives. They're trying to make sure that people who are eligible for benefits have access to them. They're trying to ensure that people who are on the program can transition to self-sufficiency. They're trying to minimize fraud. They're trying to minimize their operational costs, because states actually pay half of the operational costs. And they have a whole bunch of procedural and policy levers at their disposal to try and maximize these outcomes, and they do. They make changes pretty frequently. In the last, I think, 10 or 15 years, we've seen some pretty sweeping changes to how these programs operate. The problem is that they're not really able to tell whether each of these changes is actually contributing to the objectives. So if they're changing something like the documentation requirements for demonstrating that you are eligible for benefits, that's something that could be reducing fraud. Or if it has no impact on fraud, it actually could be driving up administrative costs if it's causing your workers to spend more time on this documentation requirement. But because when states implement changes like this, there's so many other things that are going on at the same time. There's economic changes, there's changes in other program rules, and oftentimes they're implementing several changes at once. They really can't isolate what the effect is of any of these policy levers, of where people conduct their eligibility interview, what information do they is required to put in an online application, how long are certification periods, all of these changes. It's very hard to isolate what the impact is. Rapid cycle evaluation is a way of testing these changes so that agencies can tell, okay, yes, this is a change that's actually contributing to the outcomes that we care about, to the objectives that we care about, or this is a change that isn't, or maybe having some adverse consequences.
So I think it's time to move to audience Q&A. So I've got a few questions in my back pocket if no one has questions, but it looks like we do have. Yeah. And just a reminder to the webinar audience that you can continue to submit questions via the Q&A panel.
Jennifer, you said putting data in the hand. Oh, Carolyn Brock, Matrix Measurements Consulting. You talked about putting data in the hands of the decision makers and democratizing. I'm all for that. I'm also interested in the cautions. So in the research model versus the analytics model, in the research model, you start with the premise of a null hypothesis and you see if you have enough evidence. In analytics, managers are not trained in that kind of thinking. What components of the researchers' training needs to be transferred to managers for this to be reasonable?
Great question, Carolyn, and I know you and I have had this conversation many times. I mean, I would say this is not without challenges, and I think we need to be careful not to think, I think we need to be thinking about where we want public systems to go, not necessarily just where they should be now, and sort of setting ourselves up for that. Because I do have a little bit of fear that this whole movement is going to be a flash in the pan. We're going to have a bunch of managers who will become more cynical about data, and that could be bad for all of us, I think, in the long run. You know, I would love to embed a researcher in every single one of these jobs, right? I mean, I do think there's training on, and I always come back to sort of basic training on threats to validity that you get when you are trained as a researcher that allow you to say, what is the question I'm trying to ask or trying to answer? What are the limitations? How far can I take this data? So the example, I think, from the last panel of sort of if you only have 20% of the population you're trying to generalize to in the data set, that's something you need to be aware of. The causal inference issue, I think, has caused a lot of heartache in policy and programmatic audiences for some good reasons, but at the same time, we have to take it seriously, and I think there is a risk here of people not understanding when you can assume causality from data that you're seeing versus understanding it as a descriptive and sort of understanding the problem issue. You know, I have maybe too much faith in the next generation of workers, having grown up with so much data at their fingertips and hopefully a more analytic perspective generally. So some of this I'm hoping will work out, but I do think, you know, there's the What Works Cities initiative that's going on right now that I think is really trying to build capacity at the city level. I personally would love to see something similar at the state level. I mean, because having the folks who know how to look at the data, know what to make of the data, understand the limitations of what they can and can't say from the data, that's something many places do not have. And then also just having the bodies who have the time to step back and think reflectively and be planful is also sort of an added expense. So, I mean, I would like to see the schools that are working, that are sort of feeding into management and government systems, really spending some time with folks on, you know, not just we have this hot data, let's churn out everything we can churn out from it, but really understanding the idea of threats to validity and how far can you go and how do you conceptualize appropriate questions given the data you have.
Just to add to that, I also think it's incumbent on organizations like Mathematica to, you know, when we're engaged in this conversation with an agency around, you know, let's develop the tools to help with decisions that are important to you, that we're very explicit, and we're presenting the information in a way that really tries to, you know, convey, there's limitations to this in terms of what inferences you can and can't draw, and so I think that's partly our responsibility for sure.
Crystal, do we have any questions from the webinar?
Yes, we do. We have a question. Problems and solutions are not siloed, but programs and data often are. How do you get programs to work together to address the pressing questions in the future?
Well then, one quick response to that. So I think one of the ways of getting people to come together and sort of realize some of the overlap that they have between the questions they're trying to answer, the problems that they're trying to address, is by being much more open and much more sharing with the data that we are generating. Not only the data, but also the analysis. And so things like open data policies, I think, are a step in the right direction for this. I think things like the sorts of infrastructure, like, you know, open data communities or even centralized databases can be very useful in making sure that everybody has access to information about what other people are doing, what challenges that they're trying to address. And I think there's going to have to be some sort of organic piece to people saying, hey, you guys are working on that, I'm working on this, they overlap a lot. I don't think that's going to be a sort of top-down centralized solution, but I think open data and more engagement and more sharing is a step in the right direction.
I think actually sort of bundled up within that question is also an issue of security, because that can often be one of the sticking points in getting agencies to sort of share data, is the data security side of things. And so it takes a recognition of, you have to be very sensitive and safe with the data. But I think it also takes, from an agency level, a real champion at a senior level to really see the potential for, if we can bring these data sets together, what we could actually do in a much better way.
Yeah, I would echo that. We're actually having a meeting to talk about some of the challenges in integrating data later this week. And I think this issue of privacy is huge, and sort of how we be respectful and very sensitive about privacy issues, especially, I think at the governor's level, this can kind of blow up on them. So, but I do think I have a lot of optimism. It's funny, I'm not normally an optimistic person, but I think we're seeing more movement in the performance measurement world around the idea of cross-agency goals and sort of really saying, we want to reduce veterans' homelessness, or we want to reduce homelessness, we want to reduce infant mortality. And this, to me, has some possibilities of breaking down the fights we have about accountability in individual funding streams and saying, how do we work together to move this outcome? You still have to deal with the connection of the data systems and such, and that's where I think the senior leadership saying, I want to move this outcome, and we need to figure out how to connect these programs and these systems in order to get there, can be really powerful.
Okay. I think that's all the time we have. Thank you so much, everyone.
Thank you, everyone, for attending today's forum. We hope you enjoyed the discussion. If you'd like to revisit any of it or share it with your friends and colleagues, it'll be posted on the CIRE website next week. For those of you in the room today, if we were unable to get to your question, I hope you'll join us and put your questions to the panelists in the networking reception that's going to follow immediately here in our lobby. Then finally, I would just ask for those of you here and on the webinar, please be sure to let us know how you think we did by completing the comment card in your folder or the electronic survey that we'll send out. Thank you very much.